What are public health emergency waivers for telehealth laws? Imagine being able to see your doctor or therapist without leaving your home, especially during a health crisis. That's what these waivers are all about. During a public health emergency, like the COVID-19 pandemic, the government can temporarily change rules to make telehealth easier to access. These changes are called public health emergency waivers. They are not permanent but help keep healthcare flowing when it's most needed. One big change is that these waivers remove restrictions on where patients can be when they get care. Usually, Medicare and other insurance plans only pay for telehealth if patients are in rural areas or at specific locations like clinics or hospitals. During a public health emergency, these rules are relaxed so patients can get care from their own homes or any place they choose. This makes it much easier for people to see their doctors or mental health providers without traveling. Another important aspect is that more types of healthcare professionals can now provide telehealth services. Before, only certain licensed doctors or specialists could do this. Now, therapists, counselors, and other qualified health workers can also offer remote care. This means more options for mental health support and regular checkups. The waivers also allow for audio-only visits. That means patients can talk to their providers over the phone, even if they don't have internet or a video-capable device. This is especially helpful for those who might not have high-speed internet or smartphones. It makes mental health therapy and routine doctor visits more accessible for everyone. States also temporarily waived licensure rules, so healthcare providers can offer services across state lines. This helps patients continue care if they move or travel, and it expands the reach of telehealth platforms. Providers can serve more patients without worrying about licensing restrictions during the emergency. Remote patient monitoring is another area that benefits from these waivers. They make it easier for providers to bill for and use devices that track health data remotely. Patients with chronic conditions can be monitored regularly without in-person visits, which is safer and more convenient. It's important to remember that these waivers are temporary. They last as long as the public health emergency is declared, but they can be extended. For example, during the COVID-19 crisis, some waivers were extended until March 31, 2025. However, if Congress does not act, some rules might go back to normal. Setting up telehealth appointments becomes simpler with these waivers. Patients can use more platforms, and providers face fewer barriers when offering remote services. This flexibility helps keep everyone connected to healthcare during difficult times. In summary, public health emergency waivers for telehealth laws are temporary rules that make it easier to access healthcare remotely. They remove location, technology, and licensure barriers, helping doctors, therapists, and patients stay connected during emergencies. These changes have played a big role in maintaining healthcare access when it's needed most and continue to influence future telehealth policies.